balance tradition with modernity and carry the world in their lap.
And when mental health gets impacted of women, it's not just them, it's the whole family, whole society which suffers.
There are well-established links between the risks of developing psychiatric disorders and the social realities of women's lives.
And common mental disorders, particularly anxiety, depression, PTSD, even the eating disorders, these are more common amongst the female.
The issue of women's mental health cannot be addressed by addressing psychopathology only. It's time to address positive psychology. It's time to discuss positive psychology. It's time to spread the message how to improve resilience. It's time to sensitize women how to change their life, how to understand their lives responsibly.
We are very much interested in issues regarding women's mental health, and for me I think that economics is the main issue, even in gender issues. So economic of the mental health and economic of the women's mental health and the diseases should be explored, and a lot of research should come out, and we are eager to support it.
We are suffering a different kind of challenge because we want it all. We want a profession, a job, we have confidence, we want children, we want them to be someone. So we have a lot of challenges, much more, I guess, from our previous generations.
For the scientific feast is going to be something that I think that all of us will not only just enjoy, but I think unlearn a few things and relearn a few things that would be very, very important for us, for our personal growth as well as our professional growth.
And in fact, one of the latest papers now in 2019 says that the outcome and the course of schizophrenia seems to depend more on the age of the patient as well as the social and cultural background of the sample rather than the sex.
Women have a later age of onset as compared to men. Women have more of affective symptoms, less of cognitive symptoms, less of comorbid substance abuse. Then women have a better prognosis, 50% less hospitalizations. And another thing, women also experience more side effects in terms of weight gain and hyperprolactinemia as compared to men.
Many areas which are neglected as far as the females are concerned, but one really neglected and hardly spoken about and hardly worked on is actually the area of sexuality.
And not only the societal, moral, but also in the scientific literature, women have actually been, we say research orphans, so to say, because they have been excluded from many research studies. And many of these the samples, they do not include or exclude women of childbearing age because so therefore a lot of research, particularly the treatment research and so on, does not apply to women.
Every day we see female psychiatric patients, 2/3 of whom are supposed to be having underlying serious trauma. Not the mild trauma, but the serious trauma. So are we actually, looking for this trauma when we see our female patients? Are we, if we see it, are we reporting it?
As a clinician, sometimes the only thing that I think about is probably whether I can move that woman to a safe environment.
This acts of violence, the acts of discrimination are all related to possibly contributing to the phenomena of glass ceiling.
It's not about caregivers' burden. My husband and my son is not my burden. It is my concern.
That women are going through disorders which are very unique to them. The kind of mental illnesses that they suffer are unique only to them and only to them.
Need to integrate more with the legal and the judiciary and at the school level, at the NGO level, at the level of the public, media, press, and involve the public in creating awareness.
In last 5 years, female substance abuse has rise up to 25%. 25 only in India. It is an Indian data. And why a woman taking are into the substance abuse? There are actually 3 main factors: social disadvantage, vulnerability, and lifestyle change.
First would be awareness. Second of all, access to care. Third would be destigmatization. Fourth would be sensitization, gender sensitization. Fifth, I think what we can do, we should look at an emotional self-defense.
Pick up any branch and female psychiatrists, they're pillars of in the psychiatric society.
Gender has been a critical determinant of mental health. And we have to agree to this, that men and women differ as far as their biological attributes are concerned, needs are concerned. Do we have psychiatric training that is gender sensitive? Do we have a multi-level interdisciplinary research that takes into consideration biology and psychopharmacology? How much is the health budget allotted? And what does the law say?
I only hope that this attention transforms into more and more tangible benefits to improve the mental health of women so that they can contribute wholesomely to the emotional, intellectual and social capital of the world that they reside in.
Of the 21 disorders which are there in DSM, in childhood, infancy and adolescence, 17 are more diagnosed. In fact, probably overdiagnosed in boys and girls, 1 being equally common and 3 being just underdiagnosed in females, in girls.
Mental health and domestic violence is a big issue. It's a major public health problem, and we have seen that 70% of them, the domestic violence is there in the multicentric study.
Husband has been getting his wife to you for treatment, and suddenly he comes to you, and you maybe during the treatment, wife has disclosed various things to you, their interpersonal difficulties, whatever, and then the husband comes to you one fine day asking for her records. Then you have to exercise a lot of discretion there, because the woman has been guaranteed, any patient has been guaranteed a right of confidentiality under the Mental Health Care Act.
One is we are really trying to put in place sort of better research and data around the whole gamut of women's mental health issues, because I think when we say mental health in a lot of our policy documents as well, somewhere it often gets associated with the whole the role of the woman in the reproductive cycle, and we want to say that women's mental health issues are so much beyond that.
Simply everything is not in the paper. मुझे implementation चाहिए और हम कर भी रहे हैं, और मैं ये चाहती हूँ कि lack of awareness नहीं, जितना आपको आता है आप एक दूसरे को aware करते जाओ.
While capacity assessment and its structure will help, that will hold zero meaning unless the concept of unsound mind is changed in those relevant acts.
Absolutely.
Let the IPS request the CMHA and say let the CMHA operationalize capacity for various issues till the basic statute changes.
Right.
One, we are talking about gaps and lacunae within the mental health policy documents of the country. Program, policy, act. Second, we are talking about, if I got this right, the social reality of how gender-based misuse for PMIs is much more. 3, we are talking about the other laws and the provisions of unsound mind that impact that. 4th, as Sunil and we have been saying, clear statement that active assertion in law and effort in practice for assertion of all rights of women, from menstrual rights to companionship rights to conjugal rights.
So, and 3 cheers for all the females and for the gents who have supported us and continue further the women issues and the challenges.